Okay, so we were talking, we're going to resume at the physical mobility, but we've been talking about grafts, and we're still into the acute phase. Everything's not completely covered yet with skin. We talked about how it was important to debride and get all the eschar off and get down to a level where they have a good growth bed and everything. So dressing changes, we talked a little bit about that and how we want to be real careful with cross-contamination. Hand washing is going to be a real big thing. Drug therapy to prevent infection. We said we might give antibiotics. We might wait until they show signs of infection. And we talked about their imbalance of nutrition because they're going to be in a hyper metabolic state, meaning they're going to need a lot more calories than normal to heal and repair tissue. So looking at the physical mobility, again, we're going to be, we know that often burns, especially burns that cover a large portion of the body, patient probably won't be able to ambulate, will have problems with joints. So we're going to have to do some of that for them. We'll have to do real careful positioning. Try to really get their self-perception, keep it up high. Reconstructive surgery and all might be some of the things that they're going to go through. And over time, they may go through many, many procedures over their healing period. So we can, if they've got places on their head, we can use like a donut for them to lay their head on, or bony prominences, that kind of thing, maybe in special beds. The perineum, we said that's a place that's warm and in the dark, a lot of bacteria, so we know that's going to be a place that's going to be prone to infections, watching their labs to monitor all that. And of course, range of motion, trying to keep that up and going as best we can, active and passive. This is a little bit of a recap of the labs. Remember, during that emergent phase, and any time actually, but especially in the emergent phase, they are very prone to hyponatremia. And then during the acute phase, as they go to whirlpool and that sort of thing, that's when they can also become hyponatremic by staying in the whirlpool too long or too often. Of course, they can get hypernatremic if we're giving them tube feedings, if they're too much, or you might have to alter it. Occasionally, they will have to put half strength or 3/4 strength or what have you. So if we're the ones reconstituting it, which we probably won't be because we usually use pre-mixed stuff, but we have to be very careful about. And fluid replacement too, they can get hypernatremic, so we want to be watching out for that, as we always are. We're always watching out for these signs. That's the sodium. Let's look at the potassium, because we know those go hand in hand and very important electrolytes to keep in balance. Hypokalemia, if they're, again, lengthy hydrotherapy, or if they have vomiting or an NG tube that's keeping their gastric contents sucked out. So that's a big deal. Hyperkalemic, we know that's going to be a problem with dysrhythmias, muscle weakness, EKG changes, we know that. And we know really the potassium, too low or too high, is just really detrimental. It needs to stay in that very small range. So we're going to be watching those all the time. And also remember that the patient that has renal failure already, or even renal cortical insufficiency, or just any time they have deep muscle injuries, and all that potassium is released from those cells and all, that they can become hyperkalemic. But for sure, a renal failure patient, you can just look for it because they are already out of whack with their lab results, period, but potassium, they are potentially always high, so we really have to keep a real watchful eye on them. Infection, just recapping some things, some of the complications. Absolutely, that's going to be one of our big boogers, isn't it, for anybody with major burns. And we can have localized inflammation, at one point, but very often these can go into septicemia and involve, be systemic problems. So patients, this can be a big killer of patients, so we want to be very vigilant on that. And the signs and symptoms of septicemia. Looking at their cardiovascular system, absolutely. These are the very same complications that we had in the emergent phase, and they continue on. As you can imagine, these are huge complications on these clients. Cardiovascular, neuro, always. Just recapping a little bit. Skeletal muscular, these are the same systems we talked about, all of them. And just remember also that we're looking at geriatrics, children and geriatrics, but in particular geriatrics always react slower but more devastating because of their organs are getting older, elasticity, because they have multiple problems, all that stuff we've been pounding in your head, we meant it. This is burn, one of the complications, later complications, of course it can come on earlier too, is a contracture. So we want to try to prevent those. And those, maybe some pictures in your book, I can't remember, of Job's stockings, the ones they wear for the anti-embolic type stockings that come up to their waist all the way, like giant pantyhose. We use those also for burns to help keep contractures and help with the scar tissue. And they will have them, they can do like over their head, they can have them on their arms and their legs, their chest, everything is just kind of a compression and helps to keep scarring down and also can help with some contractures as well. And those are custom fitted for these clients. This just recap, talking again about eschar, getting that gone, and putting some artificial skin or some temporary or permanent. And certainly remember about pain management, and I think we've talked about that, and morphine, and the Verseds, and all the meds, pain meds, and meds that will help them to forget the instances that are going on, or for that period of time anyway, because we surely don't want to put somebody on a vent and have them paralyzed and not give them something for their psyche, so we want to do that. Let's see, non-pharmacological certainly would be hydrotherapy, diversion therapy, music, watching TV, whatever we can get them to do to help them pass some time. And certainly physical therapy is going to be a big deal. Occupational therapy, because not all these clients are going back to the same occupation that they were in formerly. So we want to get them up to their optimum, but it may not be the optimum pre-incident. Nutrition therapy, remember we want to give them high carbohydrate and high caloric protein, carbs, vitamins for healing. And also on the pain, I want to remember we don't give initially sub-Q or PO. We always give IV medications for them because we don't want that backlog of meds sitting out there in a swollen extremity to be absorbed later, maybe all at one time. That's too. We have to control it better than that. But we will give them opioids like every 1 or 2 hours IV. Little hits IV, and we also give the combination stuff. We'll give Haldol and other meds along with it. Okay, and certainly psych care. Not every person that is burned or major burn is going to need psychiatrist, but I would bet that probably a good many will, and also family will probably need some emotional support. Now, during the rehab phase, this sometimes takes years, may take a lifetime, and as you can imagine, that'd be pretty rough stuff. Usually, healing of these wounds takes up to at least 6 months, up to even 2 years, and like I said, sometimes many more years than that, depending on how often they've had to have revisions and surgeries and all. So, very often we need to protect these healed places from direct sunlight for a year or two, because they're sensitive, very sensitive. So the rehab phase is actually defined as the beginning when the patient's burn wounds are covered with skin or healed, and the patient is able to resume a level of self-care activities. And certainly the skin and contractures are going to be big things that we're going to try to work with them on. Exercise and mobility can't be overemphasized. They need constant encouragement and reassurance, and that goes for the family as well. Need to address spiritual and cultural needs with these clients and their significant others. Maintaining a high caloric, high protein diet, throw in the vitamins and all as well. Occupational therapy, family and patient's going to need to try to learn about wounds and their wound care. They use emollient water-based creams on these sometimes, and often cosmetic surgery is needed after the healing of the major burns. And the family, as well as us, but the family in particular, needs to understand that there's real importance for reestablishing that patient's independence on things where they can do things independently, because we all need to feel like we can do things. So encourage the family to participate in their care, but also to allow the patient to do for themselves. And they might need psychiatric intervention, which goes without saying. We need to be aware of what some of the cues are that someone might need an assessment, a psycho-emotional assessment kind of thing. And that would be, sometimes one of the common emotional responses is regression. So we would need to be clued in on that. And also an issue of sexuality may have to be addressed also. And we may need some help in addressing some of those issues, because we may not know all the answers to that. So, and family and patient need to know about support groups that are available. Now, this next picture is a young woman. Here is initially after her burns, and then like a week or so, and then about 2 weeks. So not all burns, they do, some heal. That's a great thing, and you wouldn't have thought it looking at this. But I hope that you took the opportunity and watched that graphic film. It's real good. It should help you answer several questions on the test, because it really re-emphasized several things from my lecture, and plus it's just very revealing, I think. And I think I have another little thing I'll put on for you about a young woman that was injured, so I'll put that up for you as well. Thanks, and happy studying.